When incarcerating any individual, three services must always be delivered: religious, library, and medical. Medical is the only service that begins and ends with you. Likewise, it is also the most litigated. In this video, we will show you the proper procedures to handle medical responsibilities to help ensure success when dealing with a medical situation. To begin with, we must assure you that whatever happens, you are responsible. Firstly, you are responsible for the inmate's health. This begins as soon as the booking process begins and it ends with the release. However, liability continues for years. For example, if you inadvertently expose an inmate to asbestos and they later develop mesothelioma, you may be held liable. Secondly, you are responsible for staff and community health. Both inmate behavior towards others and what the inmate contracts from others are things you should keep in mind. You don't want to be responsible for an inmate giving someone hepatitis or vice versa. Finally, you must be responsible for your own health. You do not want to get sick, hurt, sued, or killed.
When beginning the booking process, it is important to know who is safe to take in and who isn't. It isn't always evident who may be secure in a holding cell, but here are some prime examples of people who should never be locked up. Unconscious. Convulsions. Significant external bleeding. Obvious fractures. Head, neck, or spinal injuries. Any serious injury. They can't walk under their own power. Symptoms of internal bleeding. Abdominal bleeding. Signs of drug or alcohol abuse. Pregnant and in labor or other serious problems. On medication, but they do not have their pills.
As you can see, medical screening is probably the most important step in determining whether or not one should be admitted to your institution. There are also more personal reasons to screen new inmates. Hospital costs and manpower drain become your responsibility, as well as future medical costs. Litigation also often follows inadequate medical care. Custody of death or suicide is transferred to you. And remember, special care is labor intensive. To determine possible chemical impairment, these three steps may be used. First, note verbal communication. Is their speech clear and concise, or slurred and confused? Second, watch their physical behavior. Are their movements appropriate or unusual? Third, test them. Breathalyzers may be used, as well as simple exercises for alcohol. Blood tests may be used to determine other chemical toxins. If an inmate has been brought in and requires prescription, 5 steps must be taken to validate the medication. First, the jail nurse or other qualified practitioner needs to take the medication and cross-reference it with a prescription drug reference book to make sure the pills are what they should be. Secondly, the nurse must validate the prescription by contacting the doctor who wrote the prescription or the pharmacy who filled it. Third, it is important to count the pills. A prescription for 50 pills filled yesterday and a bottle containing 10 pills, or vice versa, may indicate abuse. Fourth, are the pills whole? Broken pills may be a sign of abuse, such as over or under medication. And fifth, finally, a pill container should only contain the pills that have been validated for that container. If in the event an inmate requires medical attention, an authorization for treatment and release form must be filled out to allow the jail access to the incident's medical records. If surgery is required, a private practitioner or surgeon must release a medical clearance for surgery form.
To avoid these problems after booking has taken place, just remember to take general precautions. Document deviant behavior. Ask questions. Never isolate without supervision. Get medical and/or mental assistance from certified individuals, and never be complacent. Failure to recognize these actions may result in hazardous or destructive behavior such as homicide or suicide.
Suicide in jails is the most common setting for attempts and success. Suicide rates have doubled in the last 20 years and outnumber homicides. The most often day of the week for suicide attempts is Saturday, followed by Friday and Thursday, respectively. Women attempt more, but men are 3 times more successful on average. This is because women are more likely to OD or poison themselves, whereas men are more likely to use a weapon. Less than 5% of attempts seriously want to hurt themselves, and 3 out of 4 attempts give a warning sign first. Some likely attempters include alcoholics and addicts, sex offenders, individuals with character disorders, the mentally ill, or the poor.
There is no doubt that you will have to deal with a medical-related situation sometime while working in either a jail or corrections. By using the guidelines outlined in this video, you can reaffirm the safety of your institution both for yourself and those around you.